Hi, welcome to this 15-minute nuts and bolts tutorial about Stay Steady Vermont. I'm Maggie Holt. If you're listening to this, you're interested in knowing what Stay Steady is. So I'll tell you, it's a health promotion event sponsored by the Vermont chapter of the American Physical Therapy Association. We thought it would be a good idea back in 2013, and we've been doing it annually since then. It's been growing nicely. The goal is to help older Vermonters understand balance and understand their personal risk factors for falls. To be clear, we want to distinguish between steady with a Y and steady with an I. So steady with a Y, Stay Steady Vermont, are local efforts that borrow tools from steady with an I. Steady with an I is a nationally based thing done by the Center for Disease Control and organized into a great website that you can easily Google. It's a toolkit. It's designed primarily for primary care practitioners so they can recognize people when they come for their primary care, recognize them by their level of risk for falls. Our local Stay Steady events take some of the elements from the CDC's Steady with an I toolkit as shown in this diagram. That's how it's shown. So objectives for this session are nuts and bolts shown here. You should know there's another tutorial available, a short one, that goes over the performance measures and talks more about the Steady with an I. So on to what an event is. The basic recipe for a Stay Steady event is a slideshow, screenings, and recommendations. The screenings have two fundamental parts: the Stay Steady checklist, a self-assessment checklist, and the performance measures as listed here. This year, there are some sites where OTs will join in the effort to review environmental risk factors, and we're psyched about that. At any site, if there's a professional available to do orthostatic blood pressure measurements, that can be another element to the screenings. After an individual is screened, they get a result sheet to bring to their primary care physician, along with recommendations based on their category of risk. So next, I have some samples from the slideshow so you can get familiar with it. This is what the lead slide looks like. We designed the message to be positive because studies show that older adults are not drawn to a negative message like "don't fall," but they are drawn to a more positive message like "stay steady." We really try to help people draw out interaction from the audience. You'll do better at this if you practice and get organized ahead of time. Hint, hint, do it. We don't avoid the negative messages like the cycle of fear of falling and disuse, but we balance it out with positive messages. We teach about balance with a toolbox type of approach and make people aware of the interplay between many body systems needed to be stable and produce stability. And we promote activity for helping to push back against the age-related changes that undermine that balance and stability. We also introduce the Steady with an I, and we show them in advance the timed up and go, the chair stand, and the balance test that we'll do during the screenings. And we introduce them to this as part of the Steady with an I, is the Stay Independent Self-Assessment Checklist. You'll want to have people do this before they come see you for the screenings. So you work with your site coordinator to have them handed out when they first arrive, when people first arrive to the event. So after the slideshow, you'll do individual screenings and review the results. We're not going to talk about the performance measures in great detail here. That's in Mariana's tutorial, but we'll talk about the results. This is the Steady's summary fall risk checklist. We'll be using it for the first time this year. We were using a more homegrown version in the years past. You won't fill out the whole thing, just a couple of the sections, like the falls history section. The answers to those questions are found in the self-assessment tool. And in the gait, strength, and balance section, that's where you put the results of the physical performance measures. So when you're done, you'll give this sheet to the participants and encourage them to share the information with their primary care physicians and with their support system. This is the algorithm that's at the heart of the Steady with an I. When you look closely at it, you'll see that the Steady often recommends that PCPs refer to physical therapy for gait, strength, and balance. Since we PTs are doing the screening in our Steady with a Y events, our recommendations are going to be similar, but not exactly the same. First, global recommendations that you should tell everybody over 65. and everybody at Stay Steady Vermont events should learn these. They should get active or stay active. And you can look up CDC's recommendations for amount of activity at the attached website. They should talk to their doctor about falls, and they should review medications yearly to make sure they're not taking medications that are going to badly interact and cause them to be orthostatic. They should have yearly vision checks, since vision is an important risk factor for falls, and they should take measures to make their homes safer. So now, recommendations for different levels of risk. If a person scores less than 4 on their self-assessment checklist, and if they pass all the performance measures, they're considered at low risk for falls. But since low risk does not equal no risk, you still want to recommend community exercise opportunities, PT and OT opportunities, give them a pat on the back, tell them to keep it up, and come back next year. Next, for patients who are at moderate risk. This means that they've scored over 4 on the self-assessment checklist. They've had problems with their performance measures. They have 0 to 1 falls in their history, but they've had no fall-related injuries. We find that there's 2 broad categories of people who are at moderate risk. Some are aware of the problems and they've compensated. They're in the green box. Others are not aware, so they have not taken any advice on compensating. They might be the ones who feel like they're not at risk because they're very careful, in quotes, which can be code for restricting activity, lowering their activity level, growing weaker, and increasing their risk for falling. If people are aware and compensating, recommendations can be the same as low-risk recommendations. If they're not aware, people should have PTOT follow-up and start making some changes. A person at high risk for falls will score over 4 on their self-assessment checklist. They will have problems with their physical performance measures, and they will either have had a single injury-producing fall or multiple falls. These folks should be strongly encouraged to take action on preventing the next fall. Have them make a PCP appointment soon. Have them take the fall risk checklist with them. Encourage them to share the results and have follow-up with PT and OT. In all of the recommendations, getting or staying active is first on the list. We're happy to say that this year, the UVM DPT class of 2017 helped us compile a community Stay Steady guidebook, which has county-based spreadsheets and maps showing where group exercise opportunities are. It's great. The guidebook has already been disseminated to the State Fall Prevention Coalition, and Stay Steady events will be a great opportunity to disseminate it further. This brings us to a discussion about evidence-based exercise programs. In the world of fall prevention, the top choices for exercise are the ones that have research behind them, showing that they have the right combination of types of exercise and intensity of exercise to reduce the incidence of falls in a community of older adults. The slideshow shows logos of evidence-based programs that are currently available in the state. They're not in every county, but they're somewhere in the state, and we hope that they're growing in their opportunities. If you want to learn more about evidence-based programs, you can look them up on the web, or you can look to your Vermont APTA chapter to do a continuing ed event somewhere in the reasonably near future. Now we're on to who. Who collaborates to produce a Stay Steady event? The essential personnel are volunteer PTs or PTAs and a site coordinator. This year, we're happy to also have volunteer OTs, and we welcome other volunteers like nurses to do the orthostatic blood pressure screenings. These logos are some examples of collaborators in the past. I want to draw your attention to the SASH logo. SASH is an important and unique collaborator we have in Vermont. SASH stands for Services and Support at Home. It's a model for social and medical support where elders are living, like a medical home at their home. It has a coordinator, a SASH nurse, and sometimes a SASH wellness person that are organizing efforts there. It's recognized and supported by the Blueprint for Health, which is Vermont's own healthcare reform initiative. And they're happy to team up with us. They're great collaborators. That site coordinator is important because they know their community and the facility where you'll be presenting and screening. Mariana and I work closely with the site coordinators to be sure they have a good space for the event and that they'll have the IT needed for the presentation. The lead PT should make sure that the format that they bring their slideshow in is going to sync up with the projection equipment available at the site. They should also practice the slideshow, be in touch with the site coordinator, and make sure the communication is good. All PT clinicians doing the performance measures will need to bring the things listed here. A gait belt is required on every participant. A stopwatch or a timepiece that you're familiar with, a tape measure to measure things. The chair will be at the site, but you'll have to kind of find the right chair for the test. Bring a clipboard to help yourself stay organized, and bring some kind of sticky note or tape so you can mark the area for the turnaround on the TUG test. OT should be prepared to review the CDC Check for Safety handout with people and other educational things that fit into the time for screening. For orientation purposes, 2 15-minute tutorials are available and need to be viewed. Where we hold events at places where people congregate. Often that's at senior living complexes. Regarding the space for screening, we don't require private space. It's not a HIPAA protected event, and it won't be advertised as such. I actually find it helpful when people are open about their performance because it gives them a chance to encourage and support each other. This has occurred in sites where we've held events year after year, and it's a beautiful thing. We use National Fall Prevention Awareness Day as a rallying point to organize the events, and we aim to organize them in a 2-week time frame around that day, which is always the first day of autumn, first day of fall. Get it? Fall, autumn, fall prevention. We allot 2 hours for an event. Feedback from some well-attended sites is that it's important to keep individual screenings short so that everybody who wants to get screened will get a turn. At sites where turnout is low, this might be more relaxed, but overall, you really want to try to keep those screenings to 10 minutes or less. And remember, the nature of a screening is simply to identify people and then to urge them to follow up for further testing or further preventive action. You don't have to feel responsible for educating people on every point of fall prevention. Help them get an idea of how they're doing and encourage them to take the next steps. Some other things we've learned along the way. The deli ticket idea helps keep people moving in a fair and organized manner without wasting a lot of time between the screenings. The site coordinator is responsible for it, but just to keep you aware. Number 3, if you're going to be there during a mealtime, make sure the cook knows. It's only polite. Number 5, practice that slideshow so you can actively engage people. And number 6, bring in the world of IT, it always helps to have a backup. So you can bring a laptop, you can bring a thumb drive, you can email the presentation to the site coordinator so it's on their laptop. Lots of different ways. For paperwork, we'll send you most of what you need. However, you should collaborate with the others involved and create a handout that's local with other area referral suggestions. Please make sure that multiple clinicians are represented. It shouldn't be your own personal promotion opportunity. It should be collaborative. I'm sure it will be. Finally, why are we doing this? It's because older Vermonters are looking to us for help, and we need to be ready to help the aging baby boomers stay steady. PTs, we really need to be ready because we have a big role in helping with many of the major risk factors. Believe me, there are plenty of other exercise specialists who are out there willing to run in and help. And if we don't actively engage, we'll be left behind. Besides home safety evaluations and education, OTs have the opportunity to help with organizing meds so that mistakes don't lead to problems and with doing some kind of vision screening. So that's the end of this tutorial. Thank you for volunteering or considering to volunteer. I think you'll find it rewarding. I know you'll find it rewarding. I hope this was beneficial and helpful. Sorry about the dogs barking occasionally, and stay steady.